Hello, my name is Lauren Brown. I'm the chair of the Integrated Fertility Symposium, and I'm also the clinical director of AcuBalance Wellness Center in Vancouver, BC, Canada. And today I'm talking with Dr. Linky Ten Blindroth, and she is both a medical doctor and a TCM practitioner. And she has an amazing lecture for the professionals at the Integrated Fertility Symposium on PCOS, Western herbal approach using Chinese herbal energetics and principles. And I wanted to get together with Linky and just talk to her about her practice or integrative practice, and particularly PCOS. Welcome, Linky. Thanks for doing this talk for the public. You know, you're unique. You got two paradigms. Like, you've done training in two different medical fields. Can you tell us a little bit about your medical training background, please?
Yes, well, I am a medical doctor. I studied medicine in Germany and also in the US. And I always was interested in Chinese medicine. As you can see, my ancestors come from China. So I was always curious about how they were doing medicine. And at the same time, I was exposed very early in my childhood and teenage time to Western herbal medicine. I grew up in Germany. So I thought really everything would be great to integrate it. I had that idea since my teenage time, I would say. And so I studied medicine in Germany in the first private medical school there. I studied Chinese medicine in Germany, UK, China, also in the US. And then I established TCM training also at my old German university where I studied, and I still lecture there today. And I've become a general practitioner. I have my own practice in Vienna, in Austria, and I'm a licensed acupuncturist, and I'm a Chinese herbalist. But my passion is combining Western herbal medicine with Chinese medicine. And here I have also a specialty that is gynecology and especially infertility in Chinese medicine as a GP.
And since you've done the training in medicine and you've done the training in Chinese medicine, and it sounds like it's not just a hobby, the Chinese medicine, you like to integrate. So why are you adding TCM into your practice? And why would women who have been diagnosed with PCOS or struggling with infertility have any interest in this integration?
Well, in fact, it was the other way around. I was first interested into Chinese medicine, and then I added medicine to it because I thought if I want to practice, the best thing is I try to get into medical school and do both at the same time. So I always thought that Chinese medicine really contributes in many aspects to conventional medicine and the other way around. And what was your second question again?
Just why would patients be interested in this? Because you're a medical doctor. When patients see you, I'll ask this, do they see you and say, just give me the drugs, I just want Western medicine? Or do they say, I just want the Chinese medicine? Or do they say, give me what's going to work? And how would you practice? Like, how do you practice in clinic? I'm going to ask it this way. The fact that you have both, like, I'm trained in Chinese medicine, so I don't have access to Clomid and Letrozole and IVF. I work with an IVF clinic, so I'm able to recommend my patients see those doctors, and vice versa. The IVF clinic doesn't have access to the acupuncture herbal, and sometimes they'll recommend AcuBalance. You have both at your fingertips. So I'm just curious, how do you educate your patients and how do you treat if your goal is to get them pregnant as fast as possible? And as one IVF doctor says it, get them pregnant better as well. So optimize their fertility and the health of the baby and the mom.
Yes. Well, the thing is, people who come to my office, they know already that I'm working mainly with Chinese medicine, but still have the Western medicine in my mind. And that's also part of what we call integrative Chinese medicine. So we have the conventional medicine where we have the diagnostics and where we have also the guidelines, which are very important also to always have in mind. We have a network where we work also with other specialists together. But on the other hand, I always offer first line herbal medicine and acupuncture. And in herbal medicine, I use the Western herbs. And the patients who come to me, they know already that I'm giving them prescriptions with herbs. But in case they need also Western medicine, of course, I can prescribe that to them, but it's very rare. So I see myself like as the part, like especially in infertility, that patients try to conceive naturally. So before they have to go to the IVF clinic, once they have started to undergo IVF procedure, I still accompany them because it's also to minimize side effects, to make the outcome better of the IVF procedure. Very often I have patients coming here who have like 7, 8, or even more IVF hormonal stimulations without any success. And then we tried Chinese medicine parallel to that. And then in the end, both together work much better.
And that's why what you call ICM, the integrated Chinese medicine, you like to use both. I see we're seeing that kind of becoming very common practice more and more around the world. Now, you practice acupuncture, you're trained in Chinese herbal medicine, and you like to use a lot of the Western botanicals, the Western herbs, but using Chinese energetics. Can you just explain kind of why you're doing it that way, and just explain what that means? Because you're not just prescribing Western botanicals because they're good for fertility. You are bringing, it sounds like, Chinese medicine thinking into it, I think, based on your lecture.
Yes. So every Western herb that we use is also categorized in terms of the Chinese terms like yin and yang, the 5 organs, the temperature, the taste. So they also have an effect which can be categorized in terms of Chinese medicine. I think it's a great combination because the way Chinese medicine categorizes herbs in general is very, very sophisticated and very, very effective. And so my teacher, Jeremy Ross, who has developed that system to use Western herbs in Chinese medicine, has brought a lot of knowledge to that, to merge those two medicines, or phytotherapy medicines. And what we have in Western phytotherapy, we have a very well-researched background concerning constituents, concerning pharmacologic actions, safety, indications, and use. And it's also very important that we live in Europe here, and Europe has a very long tradition in Western herbs. And it's also important to recognize and to use the herbs that grow locally. So I think the combination of both Western herbs and Chinese medicine makes a lot of sense here in terms of globalization. And the same also in the US. In the US or Northern America, we have very similar herbs to what we have here in Europe.
Now, let's do something for the public here, because I know there's people listening and we've piqued their curiosity and they're wanting to know, like, what can I do? Because I've been diagnosed with PCOS or struggling with infertility. They want to understand your approach better. So can you share a little bit about kind of the lifestyle changes that you see support during that preconception care, specifically with women with PCOS? And if there's any supplements that you like, just to start to give them some tips of what some of the changes they can make on their own to optimize their hormonal environment and therefore egg quality and ovulation.
Yeah, well, from Chinese medicine point of view, we always check, from integrative Chinese medicine point of view, because I have the conventional medicine and the Chinese medicine in my mind. So if somebody, if a woman comes here with PCOS and wants to get pregnant, I first check, is there obesity or not? Because usually people think, only obese women can have PCOS, but that's not true. But if there is obesity, we very often find metabolic problems in PCOS. So from a GP point of view, of course, we need to treat that. We need to see why is there a metabolic problem. We need also to do all the blood tests for it. But then it comes to Chinese medicine, because very often it's very difficult to just only change nutrition and all just to do regular exercise. what Chinese medicine contributes here to it is that we look at the constitution of the individual patient, and then we add the medical herbs and the acupuncture. But from the point of view, what they can do by themselves, of course, is exercise, is nutrition, is diet. This is very important for them, and we have also like supplements that they can take to support their ovary metabolism. Yeah. So that is very important, but we always have to see first the constitution of each patient.
And that's what we would call then individualized medicine. So there's not a one fits all. And
no, not at all.
And thinking of your integrated Chinese medicine, like you're unique in that way that you have both the MD and the TCM. And I'm thinking in my clinic, we have the TCM and we have naturopathic physicians, but we're very aware of the Western. So we know about Clomid, Letrozole, and IVF. And so we're able to do what we do and connect and refer and work together with the IVF clinics. But I'm just realizing, so we're practicing integration, but a lot of the conventional IVF clinics, they haven't taken the time to learn Chinese medicine. So they don't have the luxury of knowing what we can do. And so that's why I really, when the women can start off with their Chinese medicine clinic, because most of the Chinese clinics, not all, but practice integratively or are very aware of the Western, so they can let you know what's available to you and are able to work side by side. You're special that way because you got it inside you. You're both. It's great. It's really great.
But still, I also work with gynecologists or IVF specialists because I work from the GP point of view. Yeah. Right. That's why I love to work with Ruth together and also to teach with her together, because we complement each other and bring both together,
And Linky's referring to Ruth Ealing is a medical doctor, OBGYN, IVF specialist, and TCM trained like Linky. And they did a talk together for IFS 2021 that's available for health professionals. And she also has a lecture. So you guys co-teach. And I kind of want to jump to that thought I had is there are some practitioners listening to this. If they want to train in your style of using the Western herbs with Chinese energetics, how do they learn from you? How do they get in touch with you?
Well, Ruth and me are both teaching Western herbs in Chinese medicine, and we teach the Western herbs according to the system of Jeremy Ross. And we offer a basic training in Western herbs and Chinese medicine. We offer also special training in gynecology and in fertility with Western herbs in Chinese medicine. And the easiest way is to follow us on Facebook, which is at ICM.net. And we plan also to give lectures at healthy seminars, hopefully, in future.
Yeah, yes, for the practitioner, we're definitely working on that. Depending on when you're watching this, it may be available free. Feel free to contact us. And then what about the patients? If they want to, I still have more questions for you, but I just wanted, since we're putting out your website, the Facebook, if somebody's in Austria and they want to connect with you as a patient, question is, can they self-refer or do they need a referral to see you? And how do they reach you?
Well, they can self-refer. Most of my patients comes through other patients, but I have also many gynecologists or fertility clinics who send to me with special questions. Especially they send the patients where they had several IVF trials without any success. So I really go into each history and check the character of how they went or underwent the IVF treatment, and then try to find a good solution for them with herbal treatment and acupuncture. So they can come by themselves as a self-referral, but they can also come through the clinics or the specialists.
And your website is?
Well, my website is still under construction, but it will be tanbleinroth.com. So TANBLEINROTH.com. And
then I have another question for you, just because you talked about working alongside IVF, where women have come into your practice where they've done like up to 8 hormonal treatments. So they could have done ovulation drugs. They could have done like a super ovulation, or they've done an IVF, not successful.
Yes.
chemical pregnancies are just not successful.
Yes.
And then you work with them and then you see some clinical results. I'm curious, in my practice, often it's like we expect a minimum of 3 months, could be up 6 months to a year, but 3 months, definitely usually need 3 to 6 months. How long should women expect to be under your care where they're doing the diet, lifestyle, doing acupuncture, herbs to see that significant change so they have a better chance of that take-home baby?
Well, it depends on the history, but 3 months is minimum because we know that in order to get the ovaries better, the ovulation or the follicles better, we need already 3 months. But it depends on, for example, if they had many stimulations, then we need more. For example, we say in Chinese medicine, each hormonal stimulation, which was not successful, usually needs 3 months herbal treatment and acupuncture before a next trial. But if they come with 7, 8 trials already, there is no time for it. Usually they are also like from concerning age, there is no time to wait so long. So I try my best to pick them up where they are and where and depending on their time limit, what we can do. But of course, lifestyle changes, which are usually very important, take longer time. It needs also more time to change one habits. Yeah, we know it needs at least 6 to 12 weeks to change one habit. Yeah. And also psycho-emotional factors play a very important role. Very often they are stressed. And we know also from studies that with stress, the ovulation is less, occurs less. And it's not only the ovulation, but it's also the quality of the oocytes. So with that, we need also time. Time is a very, very important factor. So, and what I do, for example, in young women who come here for other problems, I always do a menstrual history. And if I see there's something not okay, then I just give them the advice to also have a look at their menstrual cycle. So in order not to get a problem later. Yeah. But I had once a patient who had 7, 8 hormonal stimulation, and at the end they couldn't even fertilize the eggs. They always retrieved some eggs, but they were not able to fertilize. So what we did 9 months herbal therapy only and acupuncture, and then a natural IVF, so without hormonal stimulation. And that girl is already, I think, in grade 4 now, so it works.
I know it's nice as practitioners of Chinese medicine, we see many of these stories. It makes me think of a woman that had done IVF and she doesn't ovulate on her own. So she always needed either a progesterone withdrawal, which didn't always work, or ovulation drug for IVF. And first she had a cycle that just no pregnancy. And then the second transfer frozen was chemical. So she had an embryo she wanted to transfer, and she wanted us to work on uterine receptivity. And I said, well, we're going to treat you holistically. I can't just focus on your uterus. I can't just focus on your ovaries. We're going to focus on you. And if what we do is working well, your cycle you'll start to ovulate. That's our goal. And then maybe you'll try to conceive naturally. So try to conceive naturally if you start to ovulate before you go do your frozen. And we had to treat her for about 4 months, but she conceived naturally. And she's already had her baby. So here's somebody that's never ovulated on her own. She, in years, and only always used medication to create a bleed or to create an ovulation, and had already 2 unsuccessful IVFs. That embryo is still on ice, and she's menstruating again. So that's what the cool part is. It's not just a strategy to get you pregnant. It's, can we resolve this? Can we turn on and off genes so you are healthier? And so this is the integrative Chinese medicine approach that we like. For those that need information on the diet, I do want to let you know there is a free diet book on the AcuBalance website. It's the AcuBalance Fertility Diet with recipes, stuff geared to PCOS. Feel free to download that from the AcuBalance website. Again, if you wanted to learn more information about Dr. Linky Tan Blindroth, her website's tanblindroth.com. So as the public, you can talk to her. And also, if you're a professional, you want to learn about her training, check her out there as well. Or look to see if a health professional shared this video. They may be practicing this way. They might have been part of the IFS to see Linky and Ruth's lecture. So there's somebody to contact if you're in a different country. And then obviously, if you're in the Vancouver, BC, Canada area, please contact me and my clinic at acubalance.ca. We'd love to see you as well. Thank you, Linky.
Thank you.